Hey Max Health, Dr. Derek here. Today I want to talk to you about arthritis. I had many patients ask me about what is arthritis, how do you get arthritis? So today I want to take some time to explain that to you on the model vertebrae here. So let's get started. Right here we have two vertebrae. So the vertebrae are the bones. So we have one up here and one down here. In the middle, this is what we call the disc. The disc, it's filled up of cartilage. If you feel your earlobe, how it feels spongy like that, that's what your disc feels like, or even a gummy bear, how a gummy bear is spongy like that. That's exactly what the disc feels like. The job of the disc is to make a big hole right here for the nerve to come out. Now, when the bones move in the correct dimension, when they're actually moving normally, that's how the disc gets its nutrition. So how should the bone actually be moving? First off, it has to move from front to back, so it should be able to bend back to forward. Second, it has to be able to move from side to side, so it can bend side to side. And third, it has to be able to twist, so it should be able to twist from side to side. When the bone's moving in all these directions, then the messages are able to come from the brain, travel down the spinal cord, out the nerve, and it brings lots of nutrition to the disc. But when that bone gets out of alignment, when it gets subluxated, if this gets twisted, the bone's no longer able to move correctly, and that's what causes arthritis. That's what causes degeneration. We are able to track and see how long you've had a subluxation in your spine based off the degenerated chart right here. So here's normal. There's 3 different phases to degeneration. Phase 1, that's when we lose the overall curve to the spine. It puts more pressure on the disc, and the disc space is now getting smushed down. If this goes untreated or uncorrected, it leads to phase 2. Phase 2 is where the spurs form. So this is the more of the classic osteoarthritis. You can see there's spurs. It looks like teeth that are coming out of the front of the vertebrae. And as we look at the side, that nerve is getting pinched off more compared to the normal segment. If this goes untreated or uncorrected, it leads to phase 3. Phase 3, the bone's literally just fusing itself together, and this does not have good motion at all. This disc right here is rotting away. It's degenerating. That's known as osteoarthritis. Now, who gets this? How do people get this? What age do people get this at? We actually find people who are in their 90s who have good, healthy spines that look like this. We find people who are in their 20s who have osteoarthritis and degeneration like this. So how do people get this? It's not due to age, it's not due to how old you are, it's actually due to the misalignment of the bone, the subluxation of the bone. So the easiest way to think of this is like the tire that's on your car. If the tire on your car is lined up correctly and you drive on it, there's no issues. If the tire in your car is out of alignment and you drive on it anyway, what's going to happen to that tire? It's just going to wear and tear as time goes on. So if the bones in your spine are misaligned, if they're subluxated and you don't do anything about it, over time it's just going to wear and tear and cause more degeneration. Now, if we find patients who have degeneration in this phase 2, we actually put together recommendations to either adjust them every week or every other week for maintenance care. The reason why is, according to the latest research, if we're able to adjust this joint every 14 days, it actually helps this degeneration process from getting worse as time goes on. So if you have this osteoarthritis in the spine, by getting it adjusted, we help the arthritis from getting worse as time goes on. So I hope you guys learned something here. I'm Dr. Derek. You guys have a wonderful day. Thanks.